Core Measure 13, Clinical Summaries. The objective of Core Measure 13 is that providers give their patients a clinical summary following each office visit. The measure requires that these clinical summaries be provided for more than 50% of all the office visits within 3 business days following that visit. Now, the requirements of attestation for Core Measure 13 are a little distinct compared to the other measures that we've covered in separate videos. Whereas most of the other measures are based upon a chart level, history, unique patients, or a feature that the system provides, Core Measure 13 is actually encounter driven. So if patient John Doe, for instance, is treated 5 times, he will be counted as one unique patient in all of those other measures, but for Core Measure 13, he will be counted 5. The second unique thing about Core Measure 13 is that it requires a CPT code to indicate that E&M services are being billed. This is different because all of the other measures do not have an impact on billing the way that this one does. Now, the meaningful use aspect is still clinically oriented, so we're not bringing billing into the mix. However, even though it's a clinical requirement, it is in conjunction with the presence of an appropriate CPT code based on how CMS has defined an office visit. The numerator would be 50% of those qualifying office visits. You must produce the clinical summary within 3 business days. Now, within prognosis, this can be done on the encounter close screen in one of 2 ways. There will either be an automatic pop-up while the physician is closing the encounter, or it can be manually printed by clicking the MU Summary button. To exclude yourself from Core Measure 13 requires that there be no office visits during the reporting period. This would allow the provider to enter a 0 in the exclusion box while attesting, but if you have even one office visit that you are billing for E&M services during the reporting period, you will not qualify for this exclusion. Now, with regards to the pop-up, so that the physician goes in to close the encounter, he or she will be automatically prompted, as we see here, do you want to provide the clinical summary for meaningful use? It will be applicable except in the following cases. 1, if the encounter date is more than 3 days ago. This, again, is a time-sensitive measure. So if it has been more than 3 days, even when the physician goes to close the encounter, this pop-up will not occur. Secondly, if the encounter type has been defined as an exempt encounter, or if there is no valid E&M CPT code present, the pop-up will not occur, because those properties are what trigger the system to realize this is a Core Measure 13 encounter. 3, if you have implemented the patient portal in your practice and there's an email address on the file, then there is no need for the pop-up to occur because the clinical summary will be automatically available on the patient portal for the patient, and there's no further action for you. However, if you have the portal turned on, but there is no email address, then you will get the pop-up. And then fourthly, if the summary has already been printed, such as manually, perhaps you have assigned your staff members to print it during checkout, then when the physician goes to close the encounter, even if it is still within 3 days now, if it has already been printed, then you will not get the pop-up. And that will be indicated on the face of the MU Summary button by a check mark. Now we're going to toggle into prognosis, and we're going to take a look at producing the clinical summary. Now, again, it is on the encounter close screen, but remember the pop-up will not occur in those specific scenarios. So just for the sake of training, we're going to verify that the CPT code is present. That is on your assessment tab. Now, of course, within your practice, if you're utilizing the E&M tool, you can flow it over to assessment from the E&M lookup, or you can simply go here to the assessment tab and add it manually, which is what I'm going to do. So we're going to click on our CPT tab, and we're going to just enter the CPT code for office visit. And I'm going to save it. So now, since my encounter is dated February 12th, which you will see that on the patient banner here in the upper right. And I am actually recording this video on February 13th. It is within 3 business days. I have my CPT code present indicating E&M services. I know that that is defined in my property. So as Dr. Cooper, whom I'm logged in as, I am going to go close my encounter. Notice here in the lower left, there is no check mark on the label of my MU Summary button. And incidentally, notice how the label on this button is in white font. That also indicates that it is within 3 business days. If it was greater than 3 business days, that button would be grayed out and we would not be able to click it. So as Dr. Cooper, I'm going to mark encounter complete, sign off, and click save. And I am getting prompted, do I want to provide the clinical summary? Now, in my database, I actually have the patient portal turned on. However, in the case here of my patient, William Hopeful, there is no email address, and that is why I'm getting prompted to print it. If he had an email address on file, since the patient portal is turned on, I would not have gotten this prompt, and you do, in fact, do not even need to manually produce the summary. You will be 100% compliant in that case. Now, another thing to keep in mind when this window pop-up has occurred. Notice I have 3 options. Yes, I do want to provide it. No, I don't want to provide it, or cancel. Now, cancel would mean, let me go back to my encounter. I don't want to close it yet, so don't close it. No means I want to go ahead and close my encounter, but I don't care about printing my summary. So you certainly don't want to choose no, because that would be non-compliant, and so there's no reason to do that. However, clicking yes is the only way to get credit in that 50% numerator. So I'm going to go ahead and click the yes button. Now, one of the most common inquiries here from providers have been, but I don't want to print the summary. I've never given them to my patients. I don't want to start giving them to them now. Why do I have to? That is your discretion. To be compliant, you must provide the summary to your patients within 3 business days. So what we have done for those of you who have that feeling that you do not want to print it, it is your choice if you would like to turn the property to no. But we have a property set that will automatically print this summary when you answer yes to the default printer in your practice. If you do not want to do that, or if you would like to route it to a file, which you're going to then email the patient electronically, then you could at this point route it to a different printer, such as a cute PDF writer where it writes it to a PDF file instead of printing it. Or you could choose another printer on your network that doesn't have paper. Or at this point, you could go ahead and click cancel. Because as long as you have clicked yes in your pop-up, you're getting credit for being compliant. So then when my system refreshes, you will notice now on the face of my MU Summary button, I have a check mark. Now, with regards to the properties I mentioned, first of all, there is a property that allows you to define encounter types that are exempt. Many providers will use a hospital EMR, for instance, for their hospital rounds or for their surgery patients. However, they still need to bill for the professional component in prognosis, or they still want to document it on their schedule, so they will have an encounter in prognosis. But they don't want it to be counted towards meaningful use because they're not documenting the clinical interventions in prognosis. So those encounter types can be defined as exempt. Such as we see here, we have defined surgery and hospital as exempt. There is also a property for CPT codes. Now, it's important to note that if you are using only the standard CPT codes, then you do not need to modify this property. However, as we've got in this example, if you are using non-standard CPT codes that are not hard-coded into the property, then you will have to actually define all of the codes that you use. So for instance, the standard codes, which are hard-coded, are these 10 generally used 99201 through 99205 for your new patient office visits, and 99211 through 99215 for your established patient office visits. These 10 E&M codes are hard-coded within prognosis, so if one of those are the ones that you utilize, you don't need to worry about setting this property. However, as we've got in our example here, we are also using CPT codes for office consultations. So those codes need to be defined in addition to the default standard ones. So to show you how to do that, again, I am logged in as Dr. Cooper, so I do have access to those properties, as do any of your clinical staff members with the permissions. We're going to go under Settings Configuration. On our far right column called Admin, we have an option called Properties. So once I choose my properties, I am going to type in ARA for American Recovery and Reimbursement Act. And when I choose this property, this is where you will notice the properties that exist, where you can define the codes. So by means of a checklist, first of all, you want to make sure that there's a valid CPT code present, indicating it is an office visit. Secondly, you want to make sure that the encounter type has not been defined as exempt. Thirdly, remember that it must be printed within 3 business days of the date of service. However, there is a property. If you do not want to physically print the paper, you can set that property accordingly. Regarding the patient portal, if you have it implemented in your office, then you need to make sure that the patient has been given a user ID and password to access the portal. And in that regard, the clinical summary is automatic and you do not need to print it. But if there is no email address present, then you will have to print the summary for the patient. And please remember that you cannot retroactively print this. That is the one measure that is time sensitive, and if you fail to meet it within 3 business days, you will end up being non-compliant. And if you do that for more than 50% of your office visits, you would actually fail the mandatory measure of attestation.